초동 대응은 빠를수록 완벽할수록 이렇게 좋다. 그리고 그것에 지금 사활이 걸려 있다. 이렇게 저는 말씀드리고 싶습니다.
The daily average of confirmed COVID-19 cases in Seoul is reported as 2.9 despite a series of mass infection crises. Seoul has a population of over 10 million. It is a densely populated metropolis with a high risk of virus infection, but no city lockdown has been made. Fast preemptive response and transparent provision of information. Centering on these two principles, the Seoul Metropolitan Government cooperated closely with Korea Centers for Disease Control and Prevention. The city government has operated the Seoul Disaster and Safety Countermeasures Headquarters for 24 hours a day from the early stages to monitor new infectious diseases and disinfected public transportations and facilities used by many citizens and visitors. Seoul, while monitoring the virus, had also prepared necessary countermeasures against the COVID-19, such as citizens' guidelines, virus testing, contacts management, and quarantine treatment. To contain the virus to not spread to the local community, Seoul was committed to conducting epidemiological investigation, quarantine treatment, and identifying and tracking patients and contacts. Seoul now becomes a model for cities around the world in terms of the COVID-19 quarantine measures. At the request of cities overseas, the Seoul Metropolitan Government opened an online platform entitled CAC, which stands for Cities Against COVID-19, on April 9th, and has been sharing all information on the COVID-19 quarantine know-hows and countermeasures Seoul has taken so far. However, Seoul has not completely succeeded in COVID-19 quarantine. The first crisis came to Seoul in March, after the country's first outbreak of COVID-19 in January. A mass infection occurred at a call center in Guro District.
서울에서 발생한 집단 감염 가운데 최대 규모의 사례가 나왔습니다.
27명이 추가로 확진된 겁니다.
집단 발생 즉각 대응반을 구성해서 역학 조사를 실시하고 있습니다. 미중하게 이 상황을 인식하고 추가 확산을 막기 위해서 최선을 다하고 있습니다.
Using mobile access records and credit card transactions, the city government identified more than 1,000 contacts and conducted tests for COVID-19. The government asked for citizens for active cooperation for self-quarantine to prevent a second or third transmission of the virus to the community. Call centers and public facilities across Seoul were disinfected thoroughly.
서울시는 시민 모두가 저희들이 그 요청한 대로의 생활 방역을 철저히 해주셨고, 확진 환자 유증상이 발생했을 시에는 각 보건소에 적극적으로 검사를 임함으로써 저희들이 효과를 거두지 않았나 이렇게 생각을 합니다.
After the switch from the social distancing to the distancing in daily life in May, an unexpected mass infection occurred at clubs in Itaewon. Based on the experience of mass infection at the Guro call center, the city government tracked down the Itaewon visitors working together with the National Police Agency and the mobile service companies. The Seoul Metropolitan Government immediately introduced the anonymous testing and operated additional walk-through testing stations.
저희가 서울시에서 4개 드라이빙 스루를 운영하면서 수많은 예신 기자들이 취재 요청이 있어서 중수부용 쪽에서 지침도 혁주가 오거나 그런 걸 많이 제공한 걸로 알고 있습니다. 서울시에서는 6월 초부터 선제적 검사를 해가지고 학생이라든지 어린이들, 감염에 취약한 분들이 있는 장소를 찾아가서 선제적 검사가 지금 검수 중입니다.
As the number of confirmed cases is rising, Seoul is once again checking quarantine countermeasures against COVID-19 and conducting preemptive virus testings. The distancing in daily life has been further tightened. We must stay alert to this unpredictable virus.
And they are going through a sort of more stringent lockdown than we've had here in South Korea, because the South Korean government and I guess the Seoul government have dealt with the coronavirus in kind of unique ways, particularly in terms of testing and contact tracing and, targeted quarantining. The country's been a little bit more successful in keeping the number of cases and the number of deaths down. Well, I think the most important part of, so-called K quarantine is the contact tracing that needs to take place. In order to contain the virus, you need to know where it came from. And that means that, Western countries, the publics in Western countries are going to need to sacrifice some of their privacy in order for contact tracing to be really effective. That's the biggest lesson that I think other countries and other governments can learn from South Korea's experience in containing the virus.
Along with the immediate response of the government, dedication of the frontline medical workers, and participation of citizens who practice social distancing made it possible for Korea to be a role model in quarantine measures. Yet, COVID-19 will leave much of an impact on our society. It has changed our daily lives, and economic and social damages are also significant. For any possible outbreak in the future, what should we do to prepare? For the world after COVID-19, how can cities in the world cooperate with each other? Now, the world is paying attention to Seoul's next move.
희망을 내 곁에 둘세 너의 눈을 보고 너의 걸음에 맞춰서 널 웃게 할게 I love the song 네 사랑받을 수 있게 날 노래할 수 있게 그럼 해볼게 Oh so 왜 그래 나 이곳에서 모든 걸 준비해 너는 기대해 행복해질 테니까 하루하루가 힘든 내게 주고픈 게 많아 나 잊지 않을게 하나하나 돌려줄 거야 네가 내게 줬던 그 믿음만큼은 I love you so 희망을 내 곁에 둘세 너의 눈을 보고 너의 걸음에 맞춰서 널 웃게 할게 I love you so 네 사랑받을 수 있게 날 노래할 수 있게 그럼 내가 갈게 Oh so 왜 그래 나 이곳에서 모든 걸 준비해 너는 기대해 행복해질 테니까 Oh so 그래 나 이곳에서 언제나 너를 듣고 바라보고
늦은 밤 승복하던 너의 한숨 소리가 이 거리에 퍼질 때 너무나 지쳐버려 작은 바람에도 네 심장이 부서질 때 I'll buy you side forever I'll buy your side forever 나는 이것을 위해서 너를 느낄 수 있어 I saw you 너와 내 사이에서
Oh so 그래 나 이곳에서 모든 걸 준비해 기대해 행복해질 테니까 Oh so 그래 나 이곳에서 나 언제나 너를 듣고 바라보고 안을게
Ladies and gentlemen, good morning and afternoon and evening. Welcome to the discussion on welfare. I'm Jessica Lee, and it's my great honor to be your moderator for this session. And before we begin, we'd like to extend our sincere gratitude to everyone for joining us today at this virtual and international conference. And countries around the world are coming up with various policy measures, such as providing disaster relief money and vouchers to their citizens to minimize the damage posed by the global pandemic. So today, we're joined by welfare experts to discuss a desirable model to support vulnerable social groups by taking a look at South Korea's cases. And before we begin, for your information, we're running today's discussion live over the English version of Seoul City's YouTube channel in real time. So please do the final check of your webcam, network connection, and also your microphone condition. Thank you very much for your kind cooperation. And now, please allow me to introduce the speakers who are joining us today. And first of all, we have Mr. Kang, head of the Seoul Welfare Policy Office. As the director of the welfare policy in Seoul, he has been working hard to eliminate blind spots in welfare by helping households having financial difficulties. Thank you very much for your time today. And next, we are joined by Mr. Dongjun Oh, director of Worge General Social Welfare Center in Seoul. As a welfare worker, Director Oh will talk about the role of the local community's welfare facilities in the era of COVID-19. And next to him is Ms. Eun-ha Jung, head of the public care support team at the Seoul Welfare Foundation. And she's a doctor of social welfare studying the elderly field at the Seoul Welfare Foundation. And currently, she is in charge of the Care SOS Center at the Seoul Metropolitan Government. Once again, thank you very much for your time. And now, let us begin today's meeting. 네, 그럼 지금부터 복지분과 회의를 진행하도록
We will
하겠습니다.
now begin the welfare session. First of all, I would like to give the floor to Mr. Kang Byeong of Seoul City, who will talk about Seoul's disaster relief money program. The floor is yours, Mr. Kang.
예, 안녕하세요. 서울시 복지정책실장.
Hello everyone, I am Kyung-ho Kang. It is a great pleasure to meet you via online.
코로나 19에 대응해서 서울시에
In response to COVID-19, we are supporting the vulnerable by providing emergency disaster relief grants. And I would like to explain this to you. In 2020, there was the very first COVID confirmed case, and this led to a reduction in jobs and businesses. This led to a dramatic impact to the those with less income. And so the estimated total domestic damage was 4.4 trillion, and the estimated total loss from foreign tourists was 5.23 trillion Korean won. And in March, the number of employees was decreased by 195,000, and those on temporary leaves also amounted to 1.61 million, which was a dramatic surge. And due to declining socioeconomic activities, it led to a reduction in small business income, and also it led to higher unemployment rate and lower consumption, decrease in visitors, and especially in F&B, lodging, and tourism industry, which led to a reduction in employment, and the cost of livelihood increased, on the other hand, which has led to a devastating impact. And the welfare system of Korea was for those in the low income bracket, below the 50% at least, and the next lowest income bracket. So it would be 50% or less in terms of medium income. And higher risk people who need urgent support in crisis situations, in those cases, welfare was provided. And that is the type of support provided. But if these people have some property, then they would be excluded from the grants or the funds, and therefore they have to be assessed to see their property, which requires a long time. However, in this COVID situation, it need emergency support because we did not have time, and there were many blind spots in the original or existing welfare system. And we also wanted to know the thoughts of the citizens, those not only in the lower income, but even in the middle income group acknowledge COVID-19 as an economic crisis, according to a survey carried out in Seoul, 71% were in favor of providing the disaster emergency living expenses. And that was because there's an urgent need to provide financial support to vulnerable groups. And there was also a need, they stated that there's also a need to make plans to revitalize the domestic economy and that it is important to support those who are vulnerable but do not get any benefits from the current welfare system. And in response to the citizens' needs, Seoul came up with a response measure, and the mayor announces the comprehensive measure to support both low and medium income groups, and he stated that precedented emergency requires unprecedented emergency measures. The desperate need to directly and urgently support those who are threatened their livelihoods by the disaster and in the blind spot of the existing welfare system. And out of the welfare policies, it was the very first time to provide a welfare policy or a system to support those that are in the mid-income level. And the policy considerations were to provide temporary disaster emergency living expenses in a quick and simple process to damaged groups who face difficulties in making a living due to the disaster. And we wanted to vitalize the local economy. So this measure was not only catered to the low income, but also mid-income people. It was a very comprehensive, broad in its range and its coverage. It would include people in not only low-income workers, but small business owners and temporary workers such as part-timers and freelancers. So it would include households less than 100% of the medium income. And this is the amount that was provided depending on the member of households. And so depending on how many people lived in that household, they would receive, for example, if it's a 1 to 2 member household, $244, $325, and $406. If we had utilized income standards and also property standards to check and screen the qualifications, then it would have taken a long time. But it was an emergency situation that required urgent response. And that is why we did not use the existing welfare system. Rather, we applied a more simplified format. And by doing so, we were able to provide the grant very quickly. In the past, the same process would have taken a month or so, but through the new system, we were able to pay it 3 to 4 days after the assessment. And we followed a principle of pay first, redeem later, if not eligible. In case a person has received the expense, even if he or she does not meet the application criteria, then that person would be paid first and then reimbursed afterwards if that person could not qualify. And when receiving the applications, we do not want the spread of the virus due to submission of the applications. Therefore, we wanted to make it convenient and yet we did not want the spreading of the virus. Therefore, we carried out many channels in which the submissions could be made for the applications, such as internet, on-site applications, and we also had a 5-day rotation application system. And first, we would receive applies via online, and then afterwards, on-site applications. So on-site applications started 2 weeks after the start of the online application. So depending on what year you were born, the last digit of the year, you would go on a different date. And there were also difficulties in the community service centers to receive all of these applications. Therefore, we hired 1,930 temporary workers who could provide support. Also, visitors who were submitting the applications, they had to wear their masks. That was mandatory. And for those with disabilities or could not come to the community service centers, home visits were provided. And if we pay out such disaster emergency living expenses in cash, they might just save this up and not spend it. But then this would go against the intent of providing such disaster emergency living expenses, because this was also a means to promote the economy of the local area. So we decided that instead of providing cash, a gift cards or prepaid cards would be provided, and there would be a limitation to how long they could use it, and the districts were also limited, and the types of stores or purposes that they could use this gift card or prepaid card were limited, prohibiting the gift cards to be used in hypermarkets, department stores, entertainment places, and liquor stores. We wanted to help out the small businesses in the local areas, and we also are supporting emergency relief payout through mobile gift certificates. We are using applications through smartphone as QR codes, and 22.7% of those who received the grant received it through the local currency, and the local currency can only be used in the area, so that area, the district where they are living. And this is the result of the applications received. 2.23 million households have submitted applications, and 1.64 million households have received the expenses. And in total, it was a support of 559.9 billion KRW. And out of that, 1.136 million submitted their applications via the internet, and 1.080 million supplemented their applications on site, and 77% was prepaid cards. And the single and two-member households applied much more than what we had expected. We found out through this submission that there are very many single-member households, and that these one- and two-member households were economically extremely vulnerable, and that there was a surge in the poverty of these single and two-member households. And we are expanding we have expanded this welfare system to support single-member households such as university students, job seekers, temporary workers, and the elderly who were able to get the living expenses this time. The impact of the disaster emergency living expenses will be explained now. We started distributing this starting from March 30th to May 21st. And if you look at the usage, it was mostly used in supermarkets, convenience stores, restaurants, and butcher shops. So we see that 79% of the recipients spent the expenses to keep their livelihoods, and it helped in retail and distribution industry, including supermarkets. And through this, it appears that the expenses stimulated and revitalized the local economy. Through the disaster emergency living expense distribution, we hope that it can be a catalyzer to revitalize the local economy. And through the disaster expense living expenses, we believe that it will serve as a priming water to bring back the smiles of citizens. Thank you for listening.
네, 감사드립니다.
Thank you very much. We heard from Mr. Byeong Kang.
코로나 바이러스가 사회
So the coronavirus is impacting our society, and there is a heated interest in welfare, and Seoul was very quick in responding to eliminate any blind spots in our society. We will go on to the next presentation.
Next, Mr. Oh Dong-jun, Director of Wolgae General Social Welfare Center in Seoul, will give us a presentation on the role of the local community's welfare facilities in responding to COVID-19. The floor is yours.
이동해 주시기 바랍니다.
예, 저는 서울에 있는 월계 종합사회복지관.
Hello, my name is Oh Dong-jun. I'm the director of Wolgae General Social Welfare Center in Seoul.
그래서 한국 사회가 특히 지역 사회 안에서
Korea has been hardly hit by COVID-19. However, the local communities have been responding well to the pandemic.
상황과
So this is the table of content of my presentation. First, I would like to go over the status and progress with respect to COVID-19. Second, how the centers responded to the pandemic. And last but not least, some conclusion and suggestions.
경우입니다.
First, the status of COVID-19 and the progress that we have made. Of course, COVID-19 is a serious issue that is affecting the livelihood of the people.
확진자 발생 이후에
And since the first confirmed case, we have more than 11,000 people that have been infected in Korea, while 260 deaths occurred as of May 14th, 2020. And it has been hitting hard the economy as well as the livelihood of the families.
통해서
So, with social distancing, people now feel isolated. And the society is coping with unpredictable and unknown scenarios related to COVID-19. Now, I would like to talk about what Nowon-gu did in terms of responding to COVID-19.
그리고 그
It's one of the 15 districts in Nowon-gu.
이렇게 지역이 경계가 정해져 있죠.
And this is one of the largest district. Walge is one of the largest district in Nowon-gu.
중단 명령이 떨어졌습니다.
And in February 1st, we had to close 225 multi-use facilities in Nowon-gu.
운영을 중단하게 되면
And as a result,
구청에서는 이
that led to many ripple effects.
발생자와 관련된 정보 부분들을 홈페이지
Since then, Nowon-gu started to notify the newly infected people and their travel logs on their website.
필요성이 굉장히 높아졌습니다.
And since then,
마스크 봉사단
the demand for masks rose, which is why Nowon-gu started to mobilize volunteers to make cotton masks.
그리고 그 이후에는
In March 13th, Nowon-gu founded the Emergency Management Agency,
그러니까 약
and on March 28th, it opened a drive-in movie theater for the residents who could not go out.
감염
And of course, the confirmed cases have to be hospitalized. However, if you are a suspected case, then you have to self-quarantine yourself, which is why Nowon-gu started to operate safe accommodation services for those people.
20% 그리고
And the suspected people only need to pay 20% of the total cost,
감염 우려 대상자
which relieved their burden.
배달 서비스가 이루어지고 있습니다.
And Nowon-gu also started a safe book rental service for the residents. And to respond to COVID-19,
지원을 하기 위한 긴급
the local community established a communication channel as to provide urgent message.
코로나 관련
So the district office collects all the information and notifies information to its residents. So it's a two-way communication channel. And it also identifies the mask
가정들
and supply inventory and supplements supply shortages where necessary. At the same time, let's say that we have a confirmed case in one of the welfare centers.
단체계 부분들의 구축 준비가
Then we have to be able to respond to such emergency cases as well, which is why we have prepared the right infrastructure to meet that.
포장과
And this slide shows how our residents came together to provide masks to the residents in Nowon-gu.
전달되어
And they provided 1.1 million masks to every resident of the district for free. This is the drive-in theater that I talked about. So we used some empty parking spaces as well as some parks to run this drive-in theater. Also, we have the public servants disinfecting and cleaning some of the areas, the densely populated areas, including subway stations, as well as parks in the neighborhood. So this is done on a daily basis.
그 서울시
And the next photo shows people, the residents applying and submitting application for the emergency relief fund. Of course, you can use online channels to apply for the emergency relief fund. But if you have limited mobility, then of course we visit those households to help them apply for the emergency relief fund. And this slide shows how we delivered lunch boxes to the vulnerable class.
이용되던 사진입니다.
And of course, we had some free
식사를 도와주고 있는
cafeterias for people, for the residents. But now, since we had to shut down those cafeteria, we are now providing lunch boxes on an individual level.
지정된 장소에서
And in our welfare center, once we welcome senior residents, then we provide them with the lunch boxes. And the photos show how we do that. We do not just provide them lunch. We have to make sure that they don't have any fever. So we also check their health condition, and if they do show any symptoms, then we will take follow-up measures. We also carry out epidemic prevention activities in local community, including libraries as well as some public spaces and playgrounds for children and small parks. So we make sure that all corners of the neighborhood is clean.
장애인분들 또 고령의
And for the residents in need of necessities and food and nutrition supplies, we also deliver COVID-19 emergency home care kits that include masks as well as other emergency kits. And of course, there are some senior citizens in need of emotional support and who need to cope with isolation alone. We pay them visits and we help them cope with the isolation during COVID-19. And what we do, we give engage residents to gardening activities to grow plants and vegetables during COVID-19. So we give them a kit, a gardening kit that they can use. And we help residents actually we engage them to gardening to spend time with during COVID-19. And also we provide emotional support to relieve the sense of social isolation.
SNS라든가
We use SNS as well as our website. We pre-record videos for UCC health workouts as well as singing classes. And we were able to do this because smartphone penetration rate is very high in Korea. And senior citizens or people with disability can have access to smartphones at a very low cost. So smartphones are highly accessible in Korea, which is why we were able to leverage smartphone platforms, online platforms, to provide these types of classes. And this is another program that we conducted. And most of the welfare programs, of course, are managed by welfare centers like us. But Seoul City also provides a store, a local store, which is a store ran by small and medium-sized businesses, which help the vulnerable people so that they don't starve. And this provides various types of services to people, like haircut as well as food delivery. So it provides a range of services to the alienated people. And we have hundreds of them in Nowon-gu. And these stores were struggling because they did not have guests coming in. So, which is why we are helping those small stores survive in this difficult time. And this slide shows some examples of PPP, public-private partnership. As I mentioned, we use SNS platforms to communicate with the residents. We also communicate with the heads of the different district offices. And Kakao Talk is one of the platforms that we use to discuss with other heads of the institutions so that we can come up with a joint measure. And there was a case when we had a confirmed case in one of our centers. Then we have to shut that facility for 2 weeks, and everyone working in that facility has to be self-quarantined, and that actually happened. And when that happened, we made sure to alert all the nearby facilities so that they can protect themselves and take the necessary measures against COVID-19 infection. This is the emergency relief fund that Seoul City provides. And we have welfare centers at the district level. And these welfare centers, as well as community centers, would address the concerns of the people and also deal with the questions that people may have with respect to the emergency relief fund. So what these centers do is they communicate with each other to share the recipients as well as the progress in terms of emergency relief fund. And of course, the private sector also played its role against COVID-19, and they also support the community service centers to help the residents. And they provide urgent support to the residents who are in crisis so that they can maintain their livelihood. Next, moving on to the conclusion and some suggestions. Now, those from overseas, you may not be familiar with the welfare system in Korea. So let me tell you a little bit about Korea's welfare system. It's been about 110 years since we kicked off our social welfare system, and that started with the women's enlightenment movement in Korea. So what we do, we mobilize people and we engage them in the social welfare, and we provide social services to people. And at the same time, what the Social Welfare Center in the initial phase did was to provide services to the people after the Korean War, and also served as a home of hope for the homeless in the relief efforts during the Asian financial crisis in the later 1990s. And now we have COVID-19. And of course, we work very hard, but no single center can deal with the crisis alone, which is why we need the support of the medical staff, the hospitals, the communities, the residents, as well as the private sector to overcome the challenge together. Next, moving on to the suggestions, I have 3 suggestions to make. We cannot predict the future, the post-COVID-19 era. And of course, we may have to deal with natural disasters such as flood or earthquakes or another pandemic like COVID-19. So to be better prepared for the future, we need these 3 pillars. We need a communication system.
기본적인 대응 원칙.
We need to establish a communication system that enables effective communication during the times of crisis. And of course, the manuals are important, but
지역사회 구성원들.
we also need to communicate with the residents as well as the community centers. We need to be prepared for the next crisis. We need to review what went wrong. We need to learn from the past lessons so that we can be more flexible and agile going forward. Thank you very much for your attention. Thank you very much for the presentation. You talked about the Wolge's case in addressing COVID-19. And of course, this time is tough for everyone. And social welfare centers are hardly hit by viruses like COVID-19. And your case helped us deal better with the crisis.
Next, we will be hearing from Eun-ah-jung. She's head of the Public Care Support Team at the Seoul Welfare Foundation, and she is going to be presenting on response to blank of care through CARE SOS Center.
네, 반갑습니다.
It is a pleasure to meet you. I am Eun-ah-jung, and I will be presenting at this welfare session. Today I'm going to be talking about the CARE SOS Center, which is a new welfare policy of Seoul City. It is a new type of welfare program. So I would like to first go over what the program is, and it has been set up recently, but I would like to talk about some of the progress and the efforts that were made to fill the gap in the care. And I will be explaining what actually took place in the field. We call it CARE SOS Center. So this term might be unfamiliar for most Seoulites, and that is because this program began last year, July. And it has been less than a year since we have been operating this. And the pilot project, so this demonstrative project, is being carried out only in 5 gu's and not for the entire area of Seoul. So it has been less than a year, and it's still only in operation in 5 gu's. So it is not something that all Seoul citizens have experienced, and therefore not many Seoul citizens have encountered. It is a time for such a pilot project, and we are trying various things, and we are identifying and noticing some issues, and we are trying to supplement and make improvements to any areas that need to be improved. So it is not a complete policy yet, and it is not a complete program, but the basic framework itself is quite sturdy, and that is the smallest unit of the governance, which is Dong, and the community service center at the Dong will have managers, the care managers, and 1 welfare worker and 1 nurse. And when there is a need for care at these community service centers, they will provide quick service to them. That is the aim of this program. And so we have this program based on a policy, and the policy came about because of such backgrounds. There were changes in our environment, such as the aging population and changes in family structure, such as single and two-member families. And we are seeing many aging population, so the size of families are becoming smaller. Director Chung, when he was presenting on the emergency disaster relief grants and expenses, he explained that there was a lot of applications received from 1 and 2 member families. And through this program, we realized that there are many vulnerable single member families and 2 member families. With the aging society and as the family sizes become smaller, the problems in families could not be solved by the families alone. So there is a vacancy in the needs that have not been met, and we need to have social response to such care needs, and the public side needs to provide support to them. And of course, we do have a lot of care services, but these policies, if you look into what the care services are, there are limitations. For example, when somebody is having very long-term needs, prolonged needs because of a disability, let's say, then they will receive support. And in some cases, the support is provided based on income criteria and not the actual needs. And if this situation persists, then those who have short-term emergency needs and those who don't qualify for certain programs, they won't know where to go. When there is a need for care, they would not know where to go to seek help. And in order to respond to such situations, we felt that there are blind spots in care, and we are calling these areas blind spots of care. And in order to care for these blind spots, we have created this policy. So the vision and purpose is to fill in the blind spots of care. And the vision was that citizens should be free from burdens of care, so that there should be zero burden of care. And that was the background of setting up this Care SOS program. And as we are carrying out this program, there are various principles. For example, universal service providing for all students in need of care, and that there should be direct service provided. And there are many types of services, and these various services should be integrated, and that those are some of the basic principles in implementation, so that it should be convenient, it should be integrated, and there should be universal service. And so based on these principles, we set up the program and we are providing this service. And that is to reduce the burden of citizens in the care service. And the temporary problems, like short-term problems, could be resolved through the SOS care. And we want them to go back to their communities and community care. So services and community care concepts have been implemented here. So this slide is very crowded, and it shows the operation structure of Care SOS Center. It may look a bit crowded, but on the middle portion, this is the Community Service Center. That is where the Care SOS Center is located. So the Dong Community Service Center in the Welfare Team 2, the Care SOS Center is set up, and the Care SOS Center, here there are 2 care managers, 1 nurse and 1 welfare official, 1 nursing official and 1 welfare official. The reason why we set up the Care SOS Center in the Dong Community Service Center is because the welfare supply is based on going to the citizens. So already in the Community Service Center Dong, we have care support teams, and the welfare that goes out to find those in need is to reduce blind spots, and that there should be long-term continuous care. And there's that functional part, and the Care SOS Center will be providing services when there is that emergency need, the urgent need. And we felt that if the Care SOS Center and the Visiting Community Service Center work hand in hand, then it will have a synergy effect. That is why we put the Care SOS Center in the Community Service Center. Dong is the lowest administrative district, the smallest administrative district, and we felt that it will be closer to the community, it will be closest to the citizens, and we wanted to create a community care service system, and that is why the Care SOS Center has been implemented and set up in the Community Service Center. So this project or service is centered around the Dong Community Service Center, and we have a care team for these 5 KU. There are care support teams, and here once again there are 2 managers that are, one is the welfare official and 1 nursing official. Those working at the KU are a bit different from what the Dong managers do. The infrastructure and the resources are developed through the KU managers, and the KU care support team helps the Dong managers so that the Dong welfare managers can do their work smoothly. And there are around 17 Dongs within 1 KU, which is a unit of administration, and these KU welfare teams help out the Dong care managers, and they also carry out various important activities. And there is support for the budgets. Then the Care SOS Center, what are the services that are provided and who can receive the service? Many people ask who can receive the help from the Care SOS Center. So in principle, we're trying to make this available to all Seoul citizens. And the Care SOS Center, if there is a district that it has the Care SOS Center, you can call up the Dong Community Service Center and ask questions and receive consultation, seek information from them. At the moment, the services that we are providing, there are various types, and the direct services that can be provided are right now, because it's a demonstrative project at the moment, it's limited. At the moment, other services are for 65 years or older and people with disabilities. And next year, we may be able to provide this service for everyone, and in the second half of this year, this service will be provided to those over 50 years and older. And in receiving the service, just because you are 65 years or older and a person with disability, the manager sets up a plan, and the service providing organization will be providing the service, and then the expenses will be covered by the Care SOS. And they can receive the care through certain centers, and the expenses are being provided, and this expense will only be covered for those in the low income bracket. So it'll only be fully covered by users of the low income bracket. But in the future, we hope that it will be expanded so that all citizens can be covered for these expenses.
65세 이상 어르신이거나
So if you have a disability and older than 65 years, and if you have a care service need, then can the community center provide all of the services to them? Not necessarily, because we are trying to fill in the vacancies, the vacuums. We are trying to select those that are eligible for this. And so we have minimal criteria. It's a very simple criteria, we believe. And the qualifications, so eligibility criteria, first of all,
돌봄의 필요성을
is there a need for care in terms of functionality? So that person has to have a need in terms of functionality to receive the care. But the difference of the CARE SOS with the existing welfare programs is that such care is only provided for very long-term and permanent disabilities or functionality losses. But in our case, even if it is temporary and even if it is not that serious, then if it is an urgent and temporary situation, we are more focused on that part. So that's the criteria. And the second and third criteria will be about the vacancy of care. For example, when there is a business trip of a family member so that this person cannot receive the care, or let's say a caregiver was hospitalized, then in such urgent situations, services are provided. And the last criteria is that this person should not be eligible to receive welfare services through other programs. So we're trying to fill in the gaps, whether it is private or public. Let's say this person can receive care within the existing system, then they would not be within the coverage of our program.
다른 욕구들 현금으로 뭐 금전적인
And the reliefs, let's say it can be through some financial support, then it will be linked with other programs.
이런 업무들
So this type of work, we need to first of all identify the situation and identify whether this person is eligible to receive this care service. And that is done by the care managers at the community service centers. And so I will go into details of what the CARE SOS center managers are doing. Like I showed you, first they will have a interview with the applicant, and then there is an assessment of the person situation. But this is not just the end of what the managers do. At the CARE SOS Center, the mandatory thing that needs to be done is a visit. We always make a visit to that household. So we go out to see what the situation is, and then only after that, based on the information gathered during that site visit, a plan for care is drawn up. And in drawing up this plan for care,
활용하게 되는데요.
our services can be used, and our services can be divided into the types of services. So the information service has been excluded here because that's not included in the plan for care, but there's 8 types of services. So there are various services such as, first of all, temporary home care service, short-term facility care service, and we call these 3 daily convenience service, such as mobility support, residential convenience service, and meal delivery services. Also, there is the safety confirmation service and healthcare service.
정보 상담까지 총 8가지 서비스를
and information consultation, which is the 8th service. Using these services, we draw up a care plan, and then the service providers receive the information of what the services need to be, and the private sector service providers who have contracts with that community center will be providing the service.
돌봄 매니저분들은
So the care managers will overlook the entire process. They monitor this, and then they look at the results, and the service will be assessed to make payments to the private sector which provided the service.
예, 저희가 사업을 시작한
So since we started this program,
돌봄 SOS 센터의
the CARE SOS Center's performance has been monitored.
사실은 작년에 돌봄 SOS
Last year, the CARE SOS Center, when it was first set up, we had some difficulty in dispatching 2 managers. But now we are able to recruit the people, and so in 2020 we expected that there would be a lot of progress in our program, but with January there was a huge surge in our care service, but then after that it went down, and it's because of the COVID-19 situation. Those who need the services due to social distancing and for various reasons, they are not signing up for this service. And another thing is that at the community service centers, there is a peak in various inquiries and support that is required by the community service center. And the work of identifying these works are done by those working at the community service centers. Therefore, the care managers are actually more right now working on responding to COVID-19. That is why they were not able to identify people that need this program. But comparing last year's and this year's situation, when we look at the average, we see that those who do use the service, the amount that has been used as an expense has increased. And for some of the services, such as the home care, mobility delivery, and meal support, for these major services, we see that there was an increase in the services that are provided.
저희가 괜히 SOS 센터가 아니죠.
And we are an SOS center, so it's very important for us to be very quick and agile. That's why we are called the SOS center. And because we are an SOS center, we check how long it takes to do the work. Compared to last year, the speed and sufficiency, it seems to have become faster, and the overall period in which the service is provided has increased, but the response time has gone down.
저희가 해석하기로는
So this is how we assess the situation. The identification and receiving of the applications have become more difficult, but for the needs that have been identified, sufficient service is being provided, and there has been a lot of efforts to provide quick service to those who need the service. And it might have been because of this, but when we did a satisfaction survey compared to 2019, this year there has been an increase in the satisfaction of the service recipients.
예, 저희가 실적 분석, 수치적인 분석 외에
So in addition to the quantitative assessment of the program, we are also monitoring and collecting the cases in which the service is being provided, and we're analyzing the cases. In the process of assessing the cases, we identified COVID-19 related cases, and I think that's one of the reasons I was asked to speak here. For those who are confirmed cases and those who have been in quarantine, that has not been one of the care services provided by us. But there are some indirect related care.
우리 대표적인
that's related to the vacancies. And starting from January, we have customized services for the elderly and services for those with disabilities. And if you want to get this service long term, they have to go through assessment to receive welfare through other programs. And in the waiting process, there are cases when there is a vacancy or a gap in receiving the service. And relating to COVID-19, the assessment sometimes was discontinued completely because of COVID-19. Right now, it's resuming, but during the peak of COVID-19, there were delays in the assessment, and so in such situations, the CARE SOS service played a big role, according to the reports that we are receiving. And we set this up, we designed this in 2018, and it was a campaign pledge of the mayor. And last year, we developed the models for this program. And at the time, we could not imagine COVID-19 when we set this up last year. And our service, when we look into what is being provided, it is to care for blind spots and responding urgently. And unlike the existing welfare, it would adapt to urgent and temporary support situations. So because of these principles, in a social emergency situation, we realized that this is something that's very important. And so we were able to verify the importance of this program. And so we hope that this program develops further, and this is my summary of the suggestions for this program. Seoul City is paying keen attention to this program, and next year this program will be expanded to all 25 districts. But like I said before, the scope and the qualifications, that's very important for us to improve. And the Seoul Care SOS has not been something that many people are familiar with. And in order for more people to understand this and know this, it has to be expanded to 25 districts. And if it goes according to plan, when there is another crisis and disaster situation, the CARE SOS will provide a lot of support for all citizens. And in carrying out such programs, an area that we must pay attention to is we are trying to allot nursing officials, and that is because we are trying to include like medical services, and the medical services are not at the moment in the public sector, and we need to secure more medical resources, we feel. And another thing is that the existing welfare care system, in some cases, when there are discontinuation of services, the CARE SOS service still was provided. And it was because we could rely on the flexibility of the private sector. And we are in the beginning. That is why we don't have regulations and guidelines for the service providers, the private sector service providers. And if a situation like this occurs again, other public organizations and services, when they are discontinued, why could the CARE SOS be carried out? And we need to make preparations to make sure that the CARE SOS program is still carried out when other programs are discontinued. And since February, we are seeing a reduction in the progress rate, and we feel that it will resume in terms of its progress. And there's a lot of work for the community service center officials during disaster and crisis situations. And those who are dispatched to the community service centers really tend to help out in their other work. but we would like the managers to keep on to continuing their work. And I would like to ask Mr. Kang from the Welfare Policy Division on how these dispatch workers can keep on with their work. And with that, I would like to conclude. Thank you very much, Ms. Chung. And we have a participant from overseas.
Well, it's time to have Professor Lena Dominelli of Social Work at Stirling University and hear her presentation. Allow me to introduce the speaker. She served in IASSW and is now professor of social work at Stirling University. Today, she will be speaking about the green social work perspectives with respect to COVID-19. The floor is yours.
Hello, everyone. Hello, everyone. I'm so delighted to be. Can you hear me?
Yeah, we can hear you very well.
Can you? Okay, thank you. Good morning, everyone from the UK, and it's a pleasure to be here with you. I am so impressed by this huge enterprise and how smoothly it's run so far. So hopefully we will now start talking about my subject, which is green social work perspectives during the time of COVID. But before I start, I just want to say something about me. I am a former president of the International Association of Schools of Social Work, and I am now the chair of the Disaster Intervention, Climate Change and Sustainability Committee for the International Association. And I am also the chair of the Special Interest Group on Disasters for Social Work here in the UK for BASWA, the British Association of Social Workers. And I work with the All England Roundtable, which involves local authorities like the ones I understand are listening to us today. So that's very good. And I'm trying to develop new ways of working for social workers in disasters, and the COVID-19 pandemic has provided a really interesting example for doing that. And I started working with social workers at their request from China way back early in January when they wrote to me to say, could I support them? I've been supporting social work development in China for 30 years, and I was delighted to do that. And I learned so much from them, which then became useful in the other countries that I started to support later on. And these have varied from European countries to African countries and Southeast Asia. So without further ado, I will now begin my slides. And so as I've given you the title, and I will go on to the next slide, which is my outline. And my outline is very simply telling you what a green social work perspective is, talking about COVID-19, the roles of social workers during the pandemic, and then some of the most important elements. One is about self-care for social workers. And secondly, how can we prepare for the next pandemic? And it was nice to hear the previous speaker talk about that as well. And then I focus on a new vision for the world that involves social work as part of the center of a disaster intervention, which of course we are. So that's the outline. That's what I'm going to talk about. So I start off with defining green social work. What is it? And why is it important? I developed green social work because social workers since the 1970s have been doing ecological social work. And everybody thought they knew what that meant, and we did. It was about social institutions, primarily family, church, education, local authority services. And I suddenly realized that what was happening to our environment was completely separate from social work. And I thought, well, this cannot be right because we are the experts in the person, in the environment, and have been for over 100 years in the UK. So I thought, well, why this off? And that goes back to Brofenbremer and his ecological social work. And he focused on the social environment and ignored the physical environment. And ecological social work focused on the physical environment and sort of said, oh yeah, and don't forget this is happening in a social context. I thought that was not good enough. So I developed a new paradigm, which I then called green social work because I wanted it to convey a number of really important differences from ecological social work. The first of these is that green social work is holistic. It integrates the social, the physical, the political, the economic, and the cultural elements together in one paradigm. It also looks at how human behavior influences the physical and the natural environment, because I would argue most disasters are caused by the impact of human activities on our physical environment, and that includes the plants, the animals, the soil, the water, the air that we have been using ever since humanity arrived on Earth. So it is very important that we have this integrated, holistic approach because we must critique the way in which our current socio-economic system exploits nature, the environment, and low-paid labor. Now, we all know, if we know anything about COVID-19, that it affects those who are the poorest most. And in countries like mine, this will include people who are from Black and ethnic minority groups, but also people from the majority ethnic group, the British, white British, who are poor. Those of us who belong to the professions, we only have greater susceptibilities if we work in the professions that have an interface with human beings who are ill. So our health professionals and social workers if they visit homes. So this is really, really important. We also have to see the world, and again, COVID-19 has made this very obvious. If we trespass the human to animal barrier, we don't know what we're going to find as a result of that. And COVID-19 is just the latest example. There will be more of the what happens, the effects of the trespassing of the human-animal barrier. It is also brought to our attention in a big bang way that if we do this, the world in its interconnectedness will be affected as a whole, not little parts, although every nation state is concerned about doing its own thing for its own population. And I have to say, I've been very impressed by what you have done in South Korea, and I have learned a lot from what you have done. But it shows to me, the fact that I can learn from you shows that the world is interconnected and we are interdependent. We learn from each other, but also what happens in one place affects another. So COVID-19 went across the world like wildfire because people traveled across the world very quickly through time and space. But one of the unexpected and really good dimensions of COVID-19 is that it promotes solidarity and the public good. We, especially in the West, have suddenly realized our public services and the public service providers are amazing. We could not do without them. And it has also promoted solidarity between different groups of people, different classes of people. And for social workers, very importantly, it brought to the forefront the importance of human rights, egalitarian values, solidarity, and equality. So we have done that because we have had to deal with COVID-19. And we have also learned that actually Adversity is worse the more marginalized and the poorer you are. COVID-19, what is it? Well, I won't spend too much time on it because I assume all of you know, but it is new. We do not know everything we need to know about it. So we are fairly defenseless as a human species because we do not know how it came into the human world. We know where it might have originated from. We don't know how it's going to mutate. We're pretty sure it will. We also know that this is the first wave. We hope it's the last wave, but we're not sure. And we know that some people are more susceptible than others, but we don't know why. So why is it that if I'm Black and Asian in the UK, I will die twice as often as someone who is of European or British origins? These are all important questions that are important for us to understand and find answers to, because it is a pandemic, and a pandemic simply means it affects everyone. It is not about the degree of infectiousness of COVID itself. So this challenged social workers in a new, and in some cases, very anxiety-provoking way, because they said, well, what can we do to help? We have no skills for pandemics. We haven't had one yet in our lifetime. And I had to say to them, look, you have been trained as generic social workers. You have been trained to respond to crisis situations. You know how to interview people. You know how to assess their needs and design a plan of action to meet those needs. So you have what you know. You just do not know about COVID-19. So you have to learn about COVID-19, but you undertake and use similar skills, but in a different way. That made social workers feel more reassured because they felt they weren't starting from knowing nothing. They knew a lot. They just simply had to apply it differently. And the other thing that worried them was that they had to work and do their normal work at the same time. Like, for example, children who were in families that were abusive, families that had domestic violence amongst them, families that had needs for services without the coronavirus pandemic. And social workers themselves had to go and do home visits for some people. And they were very worried about catching COVID-19 from the people that they went to see. They were also worried that they might take COVID-19 to those they went to see if they caught it from someone else. So it was really important for them, for their own mental health and for the mental health of the people that they went to see, when they went to see them, that they knew what they had to do. So that brought into being two new skill sets for them. One was to learn how to work remotely using remote technology, as I'm speaking to you from England without moving from my house. They had to learn to do the same with people that may be abusing others. And that was quite worrying for them because they kept saying to me, what would happen if we miss a sign because we're not there or because it's happening off screen? So those were things that we had to look at. We also had to look at the impact on people's mental health and worry about that. And the third thing that we had to look at, which was new, was how do we use personal protective equipment to protect myself, my family, and the other people that I come into contact with. And that varies a lot because it depends on whose home you go into, what is going on there, but the basics are the same everywhere. You have to wear a mask. You have to know how to fit a mask. You have to know which kind of mask is good. And you have to also have a coverall over your clothes so that you don't contaminate them and then carry it somewhere else. You have to wear gloves. So here's my mask. My wonderful sanitizer for when I'm in the car, and you have to have your disinfectant wipes, and I won't show them all to you, and my disposable gloves. I never went anywhere without.
네, 저희가 지금 화상으로 조금 연결하는
I think we are having some technical difficulties because we are connected via online.
다시 되었나요?
Are you back, Professor?
I have never gone off. I see everything that you should be seeing. I can see you in my small screen. I see me in my small screen, and in the big screen, I have the PDF. It's shared. I have my shared slides.
We can see your
So
slides.
my is uploaded. I am talking to my file.
Yes, it's working
I am
fine.
now on slide 5. I am on slide 5. I can see everything. Can you see me now?
Yes, we can see you.
Yes, but I have my slides are on the shared slide, and I'm on slide 5. I will upload it again. Can you see them now?
No, we cannot see it. Professor?
Well, I have shared, but it doesn't really matter because I've been speaking, so you have heard what I've said. I've been speaking to my files.
Yes, can you please give us a presentation without your PPT on your computer?
Well, no, because to stick to the script, I have to have them on my computer. You can block them yourself. If I don't share them with you, you should just be able to see me. Let me just try and do that. This is very strange.
Then, Professor, we'll retry again, and we'll come back to you shortly. 네, 지금 시스템 문제상으로
I think we have some technical difficulties here in Seoul. And while we get ready for Professor Dominelli, I would like to ask a question to Mr. Kang. So I have a question about the disaster relief funds in Seoul, and you're also talking about disaster relief money. What would be the difference between the two, the emergency disaster relief funds and money?
In my presentation, I was saying that the existing welfare program was catered to the low-income households, but with COVID-19, the impact and the urgency of the need was very widespread, and that is why the middle income, medium income, 100% was to be included in the emergency disaster relief grants. And that was our target to provide relief to those that are in need. With the fourth industrial revolution, we are seeing jobless growth. And we are also seeing disparity in the haves and have-nots. It is aggravating. And this is another social disaster. And disaster basic income, we believe that the scope has to be wider in the new era, whether it is a disaster emergency living expense or basic expense. It is to provide relief to those in need. So in that sense, it can be seen as the same. So thank you for that answer. That now clarifies things for me. I will ask you another question, and then Mr. Kang. In your presentation, you talked about the various activities to provide support in need in the field. I was quite surprised. And those who are receiving the UNTAC service, there are many in their elderly. So in receiving the support via UNTAC measures, how is it delivered? Is it all right for them? So the non-contact services that utilize smartphones is now possible because of the penetration rate of these smartphones these days in Korea. And
관련된 정보와 교육 부분들을 무료로 하고 있습니다.
we are providing free of charge information training for the elderly on how to use smartphones. There was training that was provided to the elderly with their smartphones, and because of that, they could receive the service more conveniently. It doesn't mean that everyone, however, received this service. There are those who are suffering from dementia and who do not know how to use smartphones. In that case, they could not use that service, but the majority of elderly could receive this service, and that was quite encouraging. Next, I would like to ask a question to team leader Euna Chung. And listening to your presentation, you talked about the role of the care managers, but I felt that the private sector service providers are also very important in providing in operating this program. Do you think it's sufficient at the moment? Yes, as you said, the care managers are important, but we need to secure sufficient private service providers. And we were actually quite concerned about that too. Before we began the pilot project last year, we assessed the situation, and we found out that there are about 40 service providers per district, and 50% of them are actively providing services. And the private sector service providers, we thought that many welfare centers would be helping and participating, but we realized that that was not enough. And last year, there was a launching of a social service center that was established, and there was the visiting service, and there are many social organizations that help out with these activities. Thank you for the answer.
Yes, we have three panelists, and I have one common question for all three panelists. So the social service as of now mainly involves face-to-face contact and care, but the role of social welfare in the post-COVID-19 era should change. However, it will have limitations in addressing the loneliness as well as the mental health aggravated by the social distancing. What do you think should be the role of the social welfare in the future? So what would be the form of the new social welfare in the future? Mr. Kang? Yes, that's a very important question. So 10 years ago, when Mayor Park took office, we actually held the inauguration ceremony online, not offline. And since then, the Seoul government has been pursuing different initiatives for e-government, which has led by example. And we use ICT to provide services to the senior citizens, the isolated senior citizens. We cannot leave them alone. That can be very risky. So what we do, we use IoT services to check the room temperature as well as their motions. And we make sure that we deliver that information to the social care workers so that they know what's happening. And sometimes, let's say that there is this senior citizen who collapsed, and we will be able to know what happened because there will be no reaction from that house. And we can take emergent measures. And especially now when we have to do everything online on tech services, we have to provide more IoT services as well as other types of IT-based services. And we will continue to do so in the future. But of course, we have the social welfare service providers. And we have to work together with different agencies to be able to provide emotional support as well to the people. Yes, thank you very much. Yes, you talked about the offline the online contact and care, and I look forward to the changes of the future from Seoul City government. Now, Mr. Oh. Yes, as I said in my presentation, we have many online contact and care services such as the UCC fun workout as well as singing classes. So everything was done online in a remote setting. I do not know how effective it was, not just yet. However, I do know that online services will increase going forward. And of course, we will see more on-tech services in the future. But for that to increase, we need to combine that with offline services as well to make it more effective, especially for people with disability and senior citizens. If we can contact them with VR as well as other types of advanced services, we will be able to better cater to the needs of those people. And last but not least, I want to say that, of course, combining online and offline matters. But let's say that, the information that you have in your district, please do not maintain that at the district level. Please communicate with other districts and other neighborhoods. Yes, thank you very much.
Lastly, we would like to hear from Director Chung.
요즘 같은 상황이면 예전에도 참
In situations like these, when you publish a research report about online services, you would make suggestions about online services, but it was not easy for such online services to be selected. But after the COVID-19, I think such policy suggestions will be actively adopted. Online services,
확대될 것
we expect it to expand.
있는 계층들의 문제가 더욱
But due to the situation, those that are vulnerable, their situation might aggravate and it might be overlooked. It might go unnoticed. Therefore, we need people who have expertise to identify needs. And I think that the role of experts and specialists will become more important. So we need to find ways to train and nurture them and to utilize them. And the importance of services that go out will become more important. So we heard the answers of all of our panelists. Let us now connect with Professor Dominelli.
Could you hear me? But we cannot hear your voice. Can you please check your microphone once again?
My microphone is on now, yeah.
Yes, ma'am.
Yeah, well, I don't know what happened there because I could see you, I could hear everything you said, and I'm sorry about that, but it shows us that you cannot plan on everything in COVID. And so imagine I'm sitting there next to you in a chair, a virtual chair, and I'm going to pick up where we left off. I left off on slide number 5. I was partway through that, and I was just beginning to talk about the Chinese impact on what we learned. And I am very pleased to say that what I learned was that different countries will do different things in the COVID situation. In China, they undertook a lot of community work, which included testing people for their temperature and also disinfecting these streets and buildings in the community, as well as the normal tasks that social workers do, which is to provide specific services for specific needs. In the West, it was more about going to different service providers to provide activities that they could do. Now, I don't know if you can see my slides. Can you see the slides? Hello? Can you see my slides? Or is it best if I only talk?
Can you please give us a presentation without your slide, because we cannot see your slide on our screen.
Okay, so my next slide, which is slide 6 or would have been, is about the roles that social workers play in disasters. And there are many of them. One, they facilitate different agencies and bring resources together. So they coordinate resources for people who need them. 3, they are community mobilizers. So they will mobilize communities to help themselves and engage in mutual self-help. And social workers help them do this. 4, social workers are resource mobilizers and coordinators. So they coordinate the responses of the community and mobilize all the resources the community has and bring in resources from outside the community. 5, they negotiate with other people to bring these resources in. They negotiate with individuals to do risk assessments to find out what they need. Social workers are also mediators during COVID, and this means that they have to reassure people who are worried about their loved ones in a hospital or a care home where they cannot visit, to put their arms around them or hug them or even talk to them except by remote means. They are also consultants. A lot of social workers were consulted and had to provide services like counseling, bereavement services. Social workers also had to advocate for services, and this often meant that they had to go and argue with politicians and service providers to say, this community, this family, this individual needs your services. You must go and help them. And because they're a priority group, you must go and help them now. When everybody was overwhelmed, overstretched, and had no more space, but they had to find that space to provide a service when somebody needed it, which meant that social workers, like health workers, were working all hours of day and night. Social workers were also educators because people did not know what COVID-19 was. They had to say, this is what it is, and we hope we can educate you so that you know what you have to do and why you have to do it. Staying inside, being locked in, being shielded if you're really sick. All of these things had to be items of education for the people that were receiving the services. So social workers had to be educators. They had to be trainers as well, because they often relied on volunteers, and they had to tell the volunteers what to do. They had to train them in wearing personal protective equipment or PPE. They had to tell them how to maintain social and physical distancing when they delivered services. So there was a lot of that kind of work. And then in many countries, not so much in China, where the population is more homogeneous than, say, here in the UK, social workers had to be cultural interpreters to explain, say, to a volunteer, you are going to a Black minority group, a Black British or a Black Muslim. These are the things you have to know about their culture so that you don't inadvertently do something that is not appropriate. So they had to do that. They also were therapists, especially in psychosocial care, because people were losing loved ones. People lost so many freedoms. That's a source of grief and loss. People don't appreciate that. Every person in any country will suddenly feel the loss of being able to go out when you want, being able to go where you want. And some people feel this more than others. Some can cope better than others. But those that cannot need psychosocial support, and social workers provide that. And finally, and this is a role that a few of us play, and certainly I played it, you are a scientific translator. Now, I am because I am trained in the sciences, but I had to explain what COVID-19 was at a very basic level so people could understand. So I had to translate the science into everyday language, which was good because it meant people had another way of understanding what was going on to them. So that are key roles. There are many others that I won't go into because we haven't got time, but those are the key roles that social workers play and are still playing during the pandemic. The other thing that was really important to social workers, and social workers are not very good at doing this, and that is self-care for themselves. Very few of them thought of doing a risk assessment for themselves. Like, what did they know about putting on PPE? What did they know about wearing a mask? Did they know what I knew about the different kinds of filtration and how that affects whether this mask or that mask will be better for you during the pandemic? Absolutely not. So they had to be taught those things. But the important message they got, because they were so worried, was how important self-care is. It is not good enough to say, oh, well, I'll take care of myself when I get home. No, self-care is carried out every single day, every minute of the day as you are providing the service. But what self-care means to you individually and personally will be different from what it means to me. So you do have to do your own individual self-care assessment. Also, the other thing that was really important, besides assessing yourself and your needs, is supervision and support. Where do I get supervision and support? Well, there are two main sources, aside from your family and people that you're with during the pandemic. That is your peer group, other professional social workers like you, and your line manager. And it is really, really important that you are debriefed regularly. I argue you should be debriefed every single day at the end of a shift, because you will have been bombarded with feelings, with information, with emotions, your emotional reactions to the things you see. Some of them would have been pretty horrific, because COVID-19 is a horrible disease, especially for those who were experiencing its most serious impact. So I encourage social workers to use each other as their support groups, informal support groups, to try out different scenarios, to think, okay, when I go to see Mary, what will I do if she has X? What will I do if she has Y or Z? What will I do if her children come in to interrupt? How will I take some toys with them that they haven't seen before so that they can play with them while I talk to the mother? How will I see the children and tell them, that I cannot comfort them by putting my arms around them, that there has to be physical and social distancing? All these things that are about self-care and care for others, because the two are intertwined, are really, really difficult. I also had to help them to learn to speak about their traumas and to seek appropriate psychosocial support. I know, although social workers currently don't know, some social workers will be affected by the traumas that they have seen for a very long time, and they will need long-term psychosocial support that can stretch to years. Why do I know this? Because I know about the psychosocial impact of other disasters that have happened. For example, in Scotland, Lockerbie, that everybody knows about, one of the first airlines to be down with people that were all killed. Social workers 30 years later are still traumatized by that. I know, because I know them and I speak to them. You also have to convince your line manager that you might need long-term psychosocial support. These are all difficult conversations to have, but you must have them. The other thing that's important to learn is to learn from other people's experiences. Sometimes you'll say, well, we won't do them. Like, for example, I would never go out to test somebody in the streets unless I was a volunteer. I would never do it as a social worker. I would do other things. I would never go and disinfect the community. I would only disinfect the surfaces that I come into contact with. So there are differences. They did that in China all the time. So there are differences that we have to appreciate. There are differences between the different kinds of social workers. So what a clinical social worker will do will be different from what a community social worker will do. And I'm a community social worker above all. The other thing is that we have to be prepared to improvise, be creative, and seek information, but we have to do so safely. We cannot run risks with our health or with other people's health. The other thing that we have to do is to be reflective, critical, and innovative. So I never thought I would tell a social worker, if you haven't got an overall to put over your clothes, use plastic bags. Never in my wildest imagination. But under COVID-19, I did and I do, because if you haven't got something, you've got to find a solution. I never thought I'd say to a social worker that didn't have bleach to disinfect surfaces, unlike President Trump, I would say use lime juice. That will give you a lot of protection against viruses. And so we would improvise. We would talk about these in our groups. This is where support from your peers, from your colleagues is so important. The other thing that I advised them to do as part of their self-care was to be prepared. Never assume that somebody else has what you need. Always take what you need with you. This could include a thermos flask with a cup of tea in it for you, disposable gloves, disinfectant wipes in your office, in your car, plastic bags to dispose of the PPE so you didn't endanger other people, so that you could leave them tied up, to disinfect themselves by leaving them without any contact with human beings for at least 72 hours and preferably a week. Stay at home and self-isolate if you're ill or you think you might be ill. Talk to your line manager and say, I must stay home. Get the best online advice you can and seek support from other people when you need it. I also advise them that as part of self-care, you have to keep a record of where you are, where you've been, what you've done, whom you've seen. And why is this important? Well, you know as above anybody else in South Korea, because you need to test, contact, and trace people to find out if they have got the virus that you have got. And also, I had to say to them, stay calm, never panic. Whatever COVID-19 throws at you, do not panic. Stay safe. You cannot stay safe if you panic. And stay connected to others while keeping the social and physical distance. Note that I do not say social distancing, I say social and physical distancing, because to me it is about both. And we need to stay connected, and being connected by the internet, even if it breaks down as it did for us, is important. And finally, I would say to them in terms of their self-care, please remember that you are an essential, if sometimes undervalued, social worker. Now, I don't know if you undervalue social workers as much as we do in the UK. And really, it's a shame you cannot see slide 8, because slide 8 is really, really useful, because it tells you about how you engage with people in the community, even remotely. You're using two-way communication, or 3 or 4-way, depending on how many people there are in the group. And because they're in the community and because you are involving them, you should think of co-production. Your action plan, what you do with them, is co-production. If you consult with them about what you need to do. And so I go through the stages, and I noticed that the previous speaker before me went through similar stages. You do your risk assessment, you find out what the needs are, you try to mitigate the effects of whatever the problem is. You develop an action plan. You implement the action plan. You evaluate the action plan. And then you start again. You keep going round and round and round in a circle, always, because we have to constantly reevaluate what we're doing and rethinking about what we've done and why we've done it. Now, I was going to talk about an earthquake situation just to show you how COVID and other kinds of disasters equal kind of skill sets, but I don't think we have time to do that because it's now 11:45. But if you look at slide 8, you will see that the stages that I have been going through in terms of risk assessment planning, talking to people, getting them involved, the roles that I talked about, they're exactly the same. Whether it's an earthquake, whether it's a cyclone, whether it was the ferry that sunk off your shores, it doesn't really matter what disaster it is. The basic, generic skills that social workers have will be relevant for everyone. And you will need to remind yourself of that. So now I want to go on to what would have been slide 9, where I talk about COVID-19 was interesting, not only because it taught us about the importance of acknowledging that social workers are essential workers in a pandemic, that social workers have a lot to offer in a pandemic, that social workers have lots to do and are overworked in a pandemic, but that basic, I call them myths, that we had about a globalized world were challenged by COVID-19. The first one of these was that we could travel anywhere without any consequences. It certainly showed us we could not. It showed us that if we travel anywhere at any time and don't realize what we're going into, we can come across COVID-19 and it will wake us up with a shock. Everybody knows that now. Other things that are less clear are the importance of the public good. Under globalization and its associated neoliberal model of social development, we thought that the private sector was the best. The private sector could do everything. And now COVID has made us realize, sorry, the public sector does things a lot better, more efficiently, more cheaply than the private sector, and that the public good is what we all have to unite around. Not around private greed and making money, but providing a service as a civic duty because we care about each other, because we care about the beautiful planet that we live on, because we care about the animals, the flora, the
Lena,
flowers,
Dominelli?
the trees.
Sorry for interrupting your presentation, but due to limited time, can you please give us a 1-minute summary of your presentation? Sorry.
Well, I want to finish this slide because I only have one more in that. This is the last slide.
Okay.
Okay, so I just want to finish this. So we are going to, and the other person took forever, and I've been interrupted. This has been the worst presentation I've ever had to give, but I don't mind. I'd like to finish if I may. Thank you. I think we need to rely on our communal support systems a lot more than we were ever aware of. We have to look to each other for solidarity. We have to look to each other for reciprocity and mutuality. It is not about all one person giving and all one person taking. It is about giving and taking equally. It is about recognizing that what happens to you is going to have an impact on me, and what happens to me impacts on you. We are interdependent. We have to focus on the equal distribution of goods and resources for all the world if we're going to get rid of COVID-19. If we do not do that, it will be there forever. Now, it might become like influenza. We'll get used to it. but some people will suffer more than others and the death rate will be high. We have to recognize that human rights and the quality of life are more important than just consuming goods and services. So we are learning now, especially in the UK, we have to be less consumerist than we were before. And we had to learn it in a very unfortunate way. And finally, the biggest message is that we have to learn about caring for the environment. We are one world. We have to stay connected. We have to care for planet Earth so that it can care for us. We have to consider the needs of everyone on this planet if we are to share the resources that we have. They are limited. Again, COVID, with the lack of PPE and masks and sanitizers, I still can't buy a sanitizer here in the shops. I have to use one that I've had for 20 years because I was in another situation in pandemic. So for me, the final thing I want to say is, let us work together, let us stay connected, and let us take care of each other and the beautiful world we are in, because only in that way will humanity survive. We can survive individually because we survive as humanity. Thank you very much.
Thank you very much for sharing your words. Ladies and gentlemen, due to limited time, I'm sorry that we have to conclude the session right now. Thank you very much for your interest once again, and the discussion on public transportation will begin at 11 p.m. Korean time. Thank you once again.